Welcome to episode 2 of the She Health Talk series. My name is Dr. Sida Ekanem and I am an OBGYN trainee. Many African women suffer from cancers, and this could be easily prevented with the right information, early screening, diagnosis, and treatment. Now, if this topic sounds like something that would interest you, I want you to stick around for more. Hello there, thank you for sticking around. We're going to be talking about 5 warning signs everyone should know: cancers of the female reproductive tract. Cancers are, in lay terms, the cells that that can be termed as immortal. What do I mean by immortal? It means that these cells continue to grow beyond their normal programming. Usually, cells in the body start to grow, divide, multiply, then eventually they die off and new cells regenerate. But for cancer cells, these cancer cells escape this program pathway and continue to persist, growing beyond their potential and eventually spreading to other structures in the body. Now, the female reproductive tract comprises of the ovaries, the tubes, the uterus or womb, and the cervix, which we usually refer to as the mouth of the womb, the vagina, all right, and the vulva. Now, these parts I just mentioned make up the female reproductive tract. Now, there are 5 warning signs that could suggest that a cancer may just be lingering somewhere in any of these structures I've mentioned. And these 5 signs are as follows. Number 1, dyspepsia. Don't worry, I'm going to break it down for you. Number 2, abnormal vaginal bleeding. Number 3, abnormal vaginal discharge. Number 4, um, painful sexual intercourse, also called dyspareunia. And number 5, obvious swellings. Now, let's take a little dive into these 5 symptoms I have just mentioned. Number 1, dyspepsia. Now, dyspepsia just refers to a group of symptoms that usually would arise from the digestive system. These symptoms include nausea, vomiting, bloating, feeling easily satisfied with very little meals, and loss of appetite. Now, this symptom generally will mimic peptic ulcer disease, okay, because these symptoms could also be seen in peptic ulcer disease. But these symptoms, if they persist for up to a month, 2 months, 3 months, could be suggesting that an ovarian cancer may be developing in either of the ovaries. Okay, so this is what I mean by dyspeptic symptoms. So if you or anyone you know has this persistent complaint about having nausea, they're feeling bloated, they're getting filled easily with little meals, or they're generally losing appetite, having slight upper abdominal discomfort, then it is very important that they get to their doctor and get reviewed and on time. The next warning sign is abnormal vaginal bleeding. Abnormal vaginal bleeding just simply means any bleeding that is not consistent with your normal menstrual bleed or your normal menstrual cycle. Now, there are different types or different kinds of forms of abnormal vaginal bleeding. Number 1, if you're having bleeds in between your normal menstrual periods, this is called intermenstrual bleeding, and this will usually suggest that probably there could be a cancer arising from the womb. The next kind of abnormal vaginal bleeding is bleeding that occurs after menopause, after a woman has stopped seeing her normal menstrual cycle. This kind of bleeding is called postmenopausal bleeding, and it can suggest that there may be a cancer arising from the cervix. Another kind of abnormal menstrual bleeding is bleeding that occurs after a woman has sexual intercourse. This bleeding is called postcoital bleeding. Again, it suggests that maybe something sinister arising, or there may be a tumor or a growth arising from the cervix or the mouth of the womb. And it could means that you have to go see a doctor for further review and treatment. All right, so we are moving on to the third warning sign. The third warning sign is abnormal vaginal discharge. Every woman would experience some form of vaginal discharge during her normal menstrual cycle. However, if a woman starts developing vaginal discharge that is watery, it's foul smelling, sometimes associated with itching, and it's so much that it's even soaking the underwear and panties, then this could be a warning sign that a cancer may be growing on the cervix or the mouth of the womb. Now, usually most women will just resort to over-the-counter treatment or medications, claiming they are treating infections, but this may just be a danger sign. And so any woman having or experiencing these symptoms should please go and see a doctor for further review and treatment. The next warning sign is painful sexual intercourse. We usually refer to this medically as dyspareunia. So if a woman is experiencing pain during sexual intercourse, it could just mean that there may be a growth either on the cervix or on the vaginal walls that is probably being bruised during sexual activity. And if this is the case, such a person needs to see a doctor for further review. All right. The next warning sign is feeling of an actual mass. Now, usually for a cancer or a mass that is growing in the vagina, most women will report that they are feeling some kind of fullness, or they may just suspect that there may be a growth or something in the vagina or anywhere along the reproductive tract. An obvious growth could also occur in the abdomen. For example, her tummy and feel that there is a mass or a growth. It could just suggest that this may be an abnormal growth. And for such a person, it is advisable to go and see the doctor immediately. Okay, so I've talked about dyspepsia or dyspeptic symptoms. I've looked at abnormal vaginal discharge. I've talked about abnormal bleeding, and from before, I've talked about obvious growth and swelling. The next warning sign is weight loss. Now, if you are experiencing, or anyone's experiencing unintentional weight loss, a weight loss that you cannot attribute to anything. Usually, you note that your clothes, usually one will note that the clothes are not fitting as usual, or they're just dropping weight really fast. This is a warning sign. It means you have to go and see a doctor and find out exactly what is going on. Okay, now I have come to the end of the 5 warning signs every woman should know. I'm going to repeat it again because I feel it is so important. Number one, dyspepsia. This could suggest that there may be a cancer arising from the ovaries or the fallopian tubes. Number two, abnormal vaginal bleeding. And I've said this bleeding is not consistent with the normal menstrual cycle. This kind of bleeding would usually suggest that it could be a cancer in the womb or a cancer arising from the cervix or in late terms the mouth of the womb. The third warning sign is an abnormal vaginal discharge, usually watery, thin, and may have a bad smell that usually would not go away despite treatment with antibiotics. Number four, an obvious feeling of a swelling on a mass, usually either in the vagina or in the abdomen. Number five, I have mentioned weight loss, unintentional weight loss that you cannot explain. Don't forget, I also mentioned dyspareunia, pain on sexual intercourse. Now, weight loss will make it the sixth. Why am I bringing it up here? Because usually, for usually people may not really have these overt signs. Okay, these other signs I have mentioned, you may just notice that you're losing weight and you cannot explain it. So yes, you should go see a doctor for it. Now, how do we prevent cancers? Usually, there are screening tests that can be done, I'm going to look at two cancers that can be screened for. All right. The first one is cervical cancer. And cervical cancer is usually screened for using using a pap smear test, which we have in our environment. The pap smear test just simply means that cells will be collected from the mouth of the womb and sent to the lab, viewed under a microscope to check for any abnormal patterns. Now, this pap smear can pick up abnormal cells and help to detect the earliest stages of cervical cancer. This is so important because a pap smear screening is available. Cervical cancer is one of the preventable and treatable cancers affecting the female reproductive tract. And I will encourage any woman who is sexually active, who is still having children, should please go and have a pap smear done. This could be a lifesaver. In fact, not could be, it is a lifesaver. Okay. Now, another way to screen for cervical cancers could be through biopsies. Usually, following a pap smear, if the results are abnormal, the next line of screening would be to do a biopsy of the cervix to send to the lab to check for exactly what may be going on in the cervix. Okay, so cervical biopsy and histology, like we'll call it, the sample will be sent to the lab and the cells will be analyzed accordingly. Now, looking at ovarian cancers, they usually not there's not a standardized test, actually screening test for ovarian cancer. However, for women who have a family history of cancers, it is important that they have regular abdominal scans to assess to assess the nature of the ovaries. And for such women who have family history of cancers generally, regular abdominal scans can pick up any suspicious growths that may be arising from the ovaries. Another important test is called the CA125. Now, this is a marker, generally we call it a cancer marker, that can be assayed in the lab, can be tested for in the lab. And if those levels are abnormally high, it could suggest that there may be an ovarian cancer. Okay, so these are the female cancers that have that could be screened for. Okay, generally. So I have come to the end of this video, and I hope that you've learned so much from it. African women don't need to be dying from cervical cancer when there are actually reliable screening tests that are out there. And it breaks my heart to see that most women do not know about this. That's why this video is coming to you. I would like you to join me in the fight against cervical cancer and cancers generally. I want you to like this video, share the link, leave a comment so that other people can get to know about these warning signs and they'll be able to make the right decisions concerning their health. Thank you so much for joining this video. Cedar Cares. God bless you. See you in the next episode. Bye bye.